Well, good morning, everybody. As they briefly stated in the introductions, my name is Amaya Banks. I am the Epilepsy Programs Manager with Epilepsy Alliance Florida. I oversee our Prevention and Education Department, and I also oversee our Health Resources Service and Administration program. What we are going to be doing today is our seizure recognition and first aid presentation. So by the end of this presentation, you should be somewhat of an expert on epilepsy. Now let me go ahead and get the presentation started. Again, we are Epilepsy Alliance Florida, and this is our seizure recognition and first aid training. Now, today we are going to be addressing 4 different areas. First, we are going to talk about what epilepsy is. Additionally, we'll be able to address different types of seizures and what these seizures look like. We'll also be able to talk about seizure first aid and common misconceptions and myths that are associated with seizures and epilepsy. All right, so let's talk about your brain a little bit. Your brain cells send electrical signals to the body to tell you to move, think, feel, behave. So anything that I'm doing, moving, saying right now, those are all coming from electrical signals from my brain.
Excuse me, Amaya. Sorry.
Yes.
Are you sharing a PowerPoint?
Yes, can you not see it?
No.
Okay. Well, can you see it now?
Yes.
Okay.
Yes. Thank you.
All right. So let me just backtrack for a second. So you guys can see these 4 areas that we're going to be covering. Yes. Great. Okay. So let's keep going. All right. So like I said, your brain cells sends those electrical signals to your body to tell you to move, think, feel, and behave. Now, what is a seizure specifically? Now, a seizure is excessive discharge of electrical activity in the brain, and these things can affect your movement, your behavior, your awareness, and your sensation. So oftentimes we see seizures duplicated as different things. We see when people kind of like freeze and stare into kind of the atmosphere. We see when people shake, we see when people fall out. Those are all electrical activities that are taking place in the brain, and they show up physically differently for everyone. All right, now what is epilepsy? Now, epilepsy is a disorder of the brain, and it's associated with sudden and unpredictable seizures. And it's the most common chronic neurological condition among children in the U.S. Statistics do tell us that 1 in 26 people will develop epilepsy. Now, how is epilepsy diagnosed or tested? Now, it can be diagnosed and tested through your family history and medical history, through physical and neurological exams, through blood test, through computerized tomography, through EEG, and through magnetic imaging. What are some seizure triggers? So things that can trigger seizures: infection or fever, sleep deprivation, hormonal changes, drugs and alcohol withdrawal, stress, hyperventilation, medication, and flashing lights. Now, what are the common causes of epilepsy? Now, febrile seizures can be due to fever. They're also commonly caused by head injury, infections of the brain, lack of oxygen to the brain, disorders of brain development, excessive water in brain cavities, and it can also be caused genetically. All right, now our seizures are classified in 2 main groups. We have focal seizures and we have generalized seizures. Now, focal seizures are what's going to impair the awareness. So those are often seizures where you see like the staring spells. We also have our generalized seizures, and those are our absent seizures, our tonic seizures, our atonic seizures, our myoclonic seizures, our clonic seizures, and our tonic-clonic seizures. Now, those are the seizures that are going to impair physicalities in your body. Those are the seizures that are the most common to see is the tonic-clonic is that's when somebody shakes uncontrollably. All right, now generalized tonic-clonic seizures. Oftentimes with the generalized tonic-clonic seizures, you're going to hear a sudden hoarse cry. The person will experience a loss of consciousness. They'll oftentimes fall. They'll begin to convulse, and that's stiffening of the arms and legs, and it's followed by the rhythmic jerking. There'll be shallow breathing and drooling can occur. There can be possible loss of bowel movement and control. Occasionally, the skin, nails, and lips can turn blue. Now, these seizures generally last 1 to 3 minutes, and it's usually followed by confusion, nausea, a lot of tiredness, soreness, and speech impairment. All right. So the first aid for our generalized tonic-clonic seizures. Now, what you're going to want to do if you ever see someone experience a tonic-clonic seizure, first and foremost, you're going to want to stay calm and you're going to reassure the people around you. You're going to want to track the time of the seizure. So from when it starts to when it ends. You're going to check if the person has a medical ID card, any type of notification. Sometimes people wear bands around their wrist that let you know that there's somebody that experienced seizures or has epilepsy. You're going to remove any hazards from around. So you're going to push away tables, chairs. You're going to remove any sharp objects. You're going to want to turn the person completely on their side. And you make sure that you don't restrain them at all. Oftentimes we see people panic and they'll turn somebody on their side, but they'll try to hold their arms down. That's not something that you want to do. Also, you don't want to put anything in their mouth. That's a common misconception that somebody will choke on their tongue or choke on their own spit. You don't want to put anything in their mouth at all. Make sure to cushion their head. And once the seizure does subside, you're going to want to stay with the person until they're fully aware of their surroundings. And by staying with them, you're also going to provide emotional support and you're going to document anything that happened during the seizure. Okay, now let me push this up. I can't really see this. All right, now some things that can happen, some myths that are associated when someone has a tonic-clonic seizure. Like I just talked about, you think that you can swallow your tongue during a seizure. That's commonly a myth. It's impossible to swallow your own tongue. Should you force something into the mouth of someone having a seizure? Definitely not. We just talked about that. That's a good way to chip somebody's teeth, puncture their gums, or you can even break someone's jaw. Is epilepsy contagious? Absolutely not. Epilepsy is about contagious as a gunshot wound. You can't catch epilepsy from another person. Only kids get epilepsy. Epilepsy happens to all people of all ages and at any time. Like I said, the statistics are 1 in 26 people will develop epilepsy at some point in their life. People with epilepsy are disabled and can't work. People with this condition have the same range of abilities and intelligence as the rest of us. Some people with seizures cannot work, but others are successful and productive in challenging careers. And one thing that we definitely stress in our agency is dispelling myths surrounded by epilepsy. So we definitely focus on making sure that people that do have epilepsy are able to transition into higher education, workforce development, etc. People with epilepsy shouldn't be in jobs of responsibility and stress. Now, people with seizures disorders are found in all walks of life and at all levels of business, government, and professions. We aren't always aware of them because many people, even today, don't talk about having epilepsy for fear of what others might think. Now, let's talk about our generalized absent seizures. Now, our generalized absent seizures are going to be those seizures where you pause in activity and you have that blank stare. Those are often associated with the staring spell. You have a brief lapse of awareness. You can see possible chewing or blinking motions. Now, these seizures usually last 1 to 10 seconds. They can occur many times a day. and they're often confused with daydreaming, lack of attention, and ADD. Now let's talk about focal aware seizures. Now, our focal aware seizure, you are often have full awareness during the entirety of the seizure. First aid usually isn't required. These seizures usually last less than a minute, and they can be taken before acting out, mystical experience, and psychosomatic illness. You often have a lot of sensory symptoms, I'm sorry, and that can be changes in your vision. Often people associate stomach ache or nauseated feelings. You have an increased heightened awareness of your smell and your sound. This is often associated with deja vu, hallucinations, fear and anxiety. And you can also have isolated twitching of your arms, your legs, and your face. Focal impaired awareness seizures. Now, these seizures are awareness impaired, and you have an inability to respond. You might experience automatisms, clumsy or disoriented movements. These seizures often last 1 to 3 minutes. And people that are experienced the focal impaired awareness seizures oftentimes become combative if you try to restrain them. First aid is required, and these seizures may be confused with drunkenness or drug abuse and aggressive behavior. Now, first aid for focal impaired awareness seizures. What you're going to want to do is stay calm and reassure others, first and foremost, always. You're always going to want to track the time of the seizure. Again, you're going to check for the medical ID. You're not going to restrain. You're going to gently direct the person away from hazards. So, for example, there has been times where people have had a focal impaired awareness seizure and they can be seen walking into oncoming traffic. What you're going to want to do is slightly redirect the person away from the traffic or away from any dangers. You're going to want to stay with the person until they are fully alert and aware. Now, if this focal impaired seizure lasts beyond 5 minutes, what is routine for the person is for you to stay with them and wait for them to become fully conscious and follow emergency protocol. Now, SUDEP. SUDEP is our sudden unexpected death in epilepsy. Now, SUDEP is a sudden unexpected death related to epilepsy. It's not caused by drowning or another type of accident that could lead to death while having a seizure. SUDEP can happen with or without a seizure. About 1 in 1,000 adults with epilepsy die of SUDEP each year. Frequent seizures, especially generalized tonic-clonic seizures, are the greatest risk factor for SUDEP. So SUDEP is oftentimes where you've known someone or you've heard of someone who has epilepsy, and sometimes they die suddenly in their sleep, and they tell you that it's SUDEP. Those are usually the ways that we see it happen, which is truly unfortunate, and that's why we definitely want to raise awareness around SUDEP. Now, when is a seizure an emergency? Definitely if it's someone's first time having a seizure. If it's a convulsive seizure, so that's that tonic-clonic movement, so that's the stiffening and jerking of the arms, the legs. And if it lasts more than 5 minutes, because then we worry about brain damage after 5 minutes. Now, if they have cluster seizures, which are repeated seizures, and they don't regain consciousness, that's definitely an emergency. If the person is having a seizure and they're injured, or if they're diabetic, if the seizure occurs in water, and if normal breathing does not resume. In all of these cases, you are absolutely 100% going to call 911. All right, now what are some of the treatments for seizures? Now, some of these most successful treatments that we've seen with seizures are obviously different types of medications. They have different dosages, they have different brands, they all work differently, but we have definitely seen successful treatments from medical prescriptions. Something also that people don't know is the ketogenic diet. There's also surgical treatments. I'm sorry, let me go back. Surgical treatments. And we have different nerve stimulators. Thank you all for being attentive during this presentation. Now, if you know someone that needs help, feel free to call this 1-877 number. You can also visit epilepsyallianceflorida.com. We also have social media pages. We have Facebook, where we have different groups, different support groups online. We have a Instagram page, a Twitter page. We post all types of resources, support groups, trainings, any and everything that happens in our organization is also filtered through social media. So feel free to check out our website and our social media pages. You guys can go ahead and scan this QR code at this time. It's going to bring you through a series of questions from today's training. Give everybody time to scan. Thank you so much. Is there any questions? No? Well, thank you guys so much. I appreciate the time, and I hope that you guys have gained some necessary and vital information around epilepsy.